So, hi, Molly. Hi, Katie.
Hi.
And I want to thank both of you for being willing to jump on this call and to talk about our upcoming conference. And I am beyond thrilled that we're going to have a whole dietitian day of training as a part of this conference. And I just feel like that part of any type of eating disorder talk should incorporate about food and about how to best help people heal from their relationship with food. So I'm really thrilled to have the two of you here to talk a little bit about what you're going to be doing at the workshop. And I thought what we could do is have each of you just introduce yourselves and talk about the conference, but also anything that you want to share about who you are and what you're doing. You want to go, Molly? You want to go first?
Sure. Molly Kellogg. I'm based in Philadelphia. I have a private therapy practice here. I was a dietitian from the mid 80s until just a few years ago, and I've been a therapist since the mid 90s. I worked for many years in eating disorders as a dietitian. And now in my therapy practice, I really only use IFS. I'm very excited about the model, and I'm very excited about bringing the IFS model to dietitians. I've been doing that for a number of years now. And so there's some dietitians who actually have done some of the trainings with me who will be at the conference.
Oh,
And
great.
I'm very excited, frankly, about hearing Dick and Jean and everybody else.
Can you
So,
talk a little bit about, so the way we have it structured is Dick will do a half-day training that really goes over the model of IFS.
mhm.
And then Marcella Cox and I are going to do a talk about why we all choose to use IFS in our treatment with eating disorders. And then Marcella is going to do a talk on somatics. We're going to have a lived panel that will talk about their experience on the first day. And then on the second day, you're going to have an entire day with dietitians. And the first half of the day will be for anybody that's in person and virtual. And the afternoon,
Mhm.
if anybody's considering whether or not they should show up in person, like coming in person, I think it's going to really be an opportunity to really experience the model because the in-person dietitians will have a chance to do some practice. Is that right?
Right, absolutely. And thank you, Theresa, for allowing Katie and I to insist on doing it that way. And we're really very excited about it because the morning dietitians who are virtual and in person will be able to benefit from it, and we're excited by that. We want to make sure to have a fair amount of it experiential, and even in the morning, we will have some experiential. For example, after we do a bit of inviting dietitians to notice what parts of them are already coming up because of having heard all these wonderful presenters, we'll go into some case examples and bring in discussion of how dietitians are already using the model. And people like Katie, your friend Deborah Hines from St. Louis, and some people who I know who will be there will be able to throw in how they're using the model. And then we have some experiential stuff about how to do parts detecting, and a little bit more teachy stuff too. And the reason we really wanted to switch in the afternoon to being only um, in person is because we could then really be more experiential. The dietitians who attend, who will be virtual, do have two wonderful workshops that will be happening at the same time. One on body image. I wish I could go to that actually, and and one on using drama therapy. So they will be going to that one. But those of us in person will be doing more about the flow of the model, how to work with polarizations. Katie's going like this, yeah. Um, yeah, and how particularly dietitians can work with polarizations that they run into. Um, and uh, and we hope to do some experiential also in the afternoon about dietitians' own parts that come up. whether they're eating disorder type parts and or dietitian parts that get in the way. And of course, winding up with what are your next steps in the IFS in your learning process, and what other ways you might learn through the Institute or through the trainings that Diana Dugan-Richards and I do, or Diana and I have a newsletter too. Yeah, I will mention that to folks if they go to my website, which is mollykellogg.com, and find the page on IFS, they can sign up for the newsletter, find out about our trainings.
Great.
I feel like I've been blathering on a bit. I want to give Katy a chance to jump in, introduce herself, see what I've missed.
Course. Well, thank you, Molly, for providing such a wonderful overview. I feel like there was nothing missed. Uh, I have been very fortunate to have learned from Molly and Diane about the implementation and practice of IFS for nutrition professionals. And it's such a wonderful training if anyone is considering it, beginning to explore IFS and how to really appropriately utilize it. And this conference is going to be so exciting, and the implementation and practice and role playing even that we get to explore in person, as well as learning about it in a virtual setting too.
Mhm.
I realized I didn't really introduce myself, but hi, my name is Katy. I go by she, her pronouns. I work at Within Health as a dietitian and utilize the IFS model in both the PHP and IOP level of care, as well as my small private practice. And so I realize parts can just be all over the place from my clients and recognizing what ways these parts are really engaging in harmful ways, as well as parts that might not even be related to the eating disorder, but really important parts to name and to honor and recognize. And so I've been doing this work for about 2 years now, give or take, with gentle practice and encouragement from others and seeking consultation and support. And it's just such a gift to practice
Mhm.
IFS and watch others learn and grow and get excited about this work too.
Mhm. Yeah. Yeah, Katy, I'm so glad that you're going to be there, and also Deborah Hines, because you folks have the PHP, IOP, even residential program Deborah has worked in, which I don't have. I've always been outpatient. So there'll be a wealth of sharing going on about how to use the model in different settings with different types of clients. Mhm.
Yeah, absolutely. And parts can be really intimidating. So I think this is
Mhm. Oh, yeah.
wonderful to bridge that knowledge gap and application practice.
Mhm. Yeah. Yeah.
And I'm just,
So can you
I'm
tell we're excited, Theresa?
I'm beyond excited, and I love that um, there's going to be this balance of having you, Molly, you've been in the field for a while, and Katy, you're brand new in the field, and to have you both be there to kind of like talk about everything that you've learned along the way, Molly, and it's changed over the years, I'm sure, of like
Mhm.
looking at different.
Absolutely.
And one of the things that I was thinking about as you all were talking was when you mentioned polarizations. And I think for people that might be just kind of jumping on and watching this, or like, what are polarizations? I think we all know what polarizations are. But for me, when I think about eating disorder recovery, if we're not like thinking about the polarization of the restricting part and the binge eating part and that push and pull, or the
Mhm.
recovery part that's polarized with the eating disorder part,
Mhm.
and understanding it from the food perspective, I think we're missing it. So I'm just so thrilled that you all are going to be there and offer this training. I really believe that this is kind of like a once in a lifetime opportunity for
Mhm.
dietitians and clinicians to come and learn from amazing people.
And Dick and Jean will be there.
Yeah. Yes, exactly. Yeah, I'm beyond thrilled at this opportunity to have everybody in person and to be able to offer this
Great.
training.
Yeah.
So anything else you all want to say before we pop off?
I'm just looking forward to it. That's all I can say.
Well, thank you
Okay.
for coming on, and I will put your websites and things like that when we post this video.
Sure.
Okay.
Okay. See you soon, Theresa and Katie.
Looking forward to seeing y'all.
You too.
Yep.